at Jennifer Inskeep.
I'm an active person.
You'd never guess she had a double hip replacement.
I was very tired of hurting every time I did something active. Golf I was miserable for days after I swung a golf club. Walking and riding a bike, I was just miserable, so it's not worth it.
It was a big decision having both joints replaced in one operation, but she was happy to learn her surgeon wanted to take a different approach.
There was nothing unusual about the artificial hips. What set this procedure apart was the way her surgeon went in. Using the anterior approach, he went through the front rather than the back or side.
You do not remove any muscles or tendons off of the bone, so you're basically separating and pushing muscles apart as opposed to cutting and splitting them. That procedure done correctly dramatically improved as far as pain control and recovery times compared to standard hip replacements.
The traditional posterior approach goes through the backside. Cutting the body's largest muscle creates a higher risk for hip dislocations. Going through the front is less complicated.
It's still a safer hip for the life of the hip through an approach that you're not cutting the soft tissue that naturally protects the hip.
Jennifer was up and walking the next day and has never looked back.
Anytime you can make surgery shorter and easier and less painful with better results, I think the patient is better off.
So I do around 400 hip replacements a year, and every single one is through an anterior approach now.
Making it the safer, hipper hip procedure. For Lee Memorial Health System, I'm Amy Oshier.